day everyone. Today we are going to talk about adenoidectomy. What is adenoidectomy? Adenoidectomy means removing adenoid tissue which is present in the back of the nose. Adenoids are lymphoid tissue which can be present in the nasopharynx, which is at the back of the nostrils. And just like tonsils, they are also lymphoid organs which can increase in size during infection, inflammation or allergy. Usually these adenoids are seen enlarged in children because till you are 4 to 5 years of age, you need these adenoids and tonsils to fight against the infections which can enter through the nose and the throat. And after around 5 to 7 years, the adenoids and tonsils start shrinking, and normally they can even become very small or disappear after that age. But in some children who have very repeated infections, the adenoids may become very big and they can block the back of the nose, the space called the nasopharynx. When this happens, your child may be snoring at night. He or she may have mouth breathing because the tonsils as well as the adenoids, both when they become big, the child cannot get air especially when he lies down, and he or she has to open her mouth for creating a space for the air to go in. So this causes constant mouth breathing, and slowly the child's teeth start coming up. So this situation is a childhood apnea. This is the most common. Adenoid and tonsillar hypertrophy is the most common cause of childhood apnea, sleep apnea. So this, what happens is, when the child is not able to sleep very well at night, he or she will be tossing and turning. They become irritable in the day, and also they have reduced attention in the school or in the playtime. So this irritability can affect the learning behavior of the child. Later on, if the adenoid tissue which is present in the back of the nose can block something called eustachian tube. Eustachian tube is the connection between the nose and the ear. When the eustachian tube is constantly blocked, whenever there is an infection, the fluid collects behind the eardrum. This condition is called serous otitis media. Serous otitis media, whenever there is an infection, the fluid may collect and the nature may try to bring it out of the ear by making a small hole in the eardrum. This is called acute otitis media with a perforation of the eardrum. When this happens again and again, a child who has repeated infections, say every 2 months a child is having an upper respiratory infection, he or she may have a small hole in the eardrum in the front part of the eardrum. So this condition, when it has this kind of situation where the child is constantly mouth breathing, the child is snoring at night, he or she is irritable in the day, he or she has ear infections, you have to think the child has enlarged adenoids. For confirmation of this diagnosis, you have to take the child to an ENT doctor who will see and examine the nasal cavity, which will show a tissue which is around like pink in color, which is blocking the back of the nose. And you can examine the size of this tissue by a nasal endoscopy, and also you can validate the size of this tissue by doing an X-ray called X-ray lateral view of the nasopharynx. So this will tell us whether how big is your adenoid, is it fully blocking the airway, and does the child require surgery. Usually we wait till around 4 to 5 years before we do adenoidectomy or tonsillectomy. Why? Because till around 4 to 5 years you need these organs for fighting infection. When do you think your child needs adenoidectomy? Your child will need adenoidectomy because if there is a severe nasal obstruction and he or she is snoring severely at night, and he or she is tossing and turning in the bed, and also this condition is causing severe irritability, lack of sleep and irritation in the daytime, and the growth may be affected in the long term if this situation continues. And also, if there are multiple ear infections, might leave the child with a small hole in the eardrum, or permanently the child may have fluid which will make him a little deaf, and he or she may be facing problems in the classroom where he has to repeatedly ask the teacher what is she telling. The children may not come out with this history, but an intuitive teacher or a mother can pick this up. And if these situations are present, and also if mouth breathing is causing the teeth overcrowding in front of in the upper part of the jaw, then you have to consider adenoidectomy for the child. We don't do it until unless it has this certain indication, which is severe airway obstruction with ear infections or very regular infection which is not allowing the child to grow, or if the sleep disturbance is interfering with the growth, then we have to think of doing an adenoidectomy. How is adenoidectomy done? Adenoidectomy is done by a general anesthesia procedure, where a doctor will put an instrument, either a coblation wand or a curette, through the mouth into the nasopharynx area and gently shave off or burn off the adenoid tissue. This will open up the nasopharynx, which is the back of the nose. When the back of the nose is open, the child's nasal pathway is cleared and he or she can breathe very nicely from the nose with through which the air will enter the lung. Procedure may also be accompanied by tonsillectomy. If the tonsils are enlarged, both of them are done together in a single setting. What will happen if you don't do adenoidectomy? Adenoidectomy and tonsillectomy are what we call lifestyle surgeries. They are not essential surgery. It is not like a child has a heart defect and if you don't do that correction surgery, the child cannot survive. These are not surgeries like that. These are surgeries which improve the quality of life. So if you don't remove the adenoid, the child will have a mouth breathing, but mouth breathing continuously will affect the front teeth, and the child will have an elongated face with the overcrowding of the upper teeth, and he or she may have to go for a braces, dental braces later on in life. And in the similar setting, if the tonsil is enlarged and if tonsil is not addressed, the same situation can result. If a constantly the patient child having a severe obstruction of the airway, if he or she is not able to breathe properly, they will be irritable throughout the day, and this situation can result in attention deficit or poor school performance. Also, if the adenoid tissue is severely enlarged and it is blocking the eustachian tube exits, eustachian tube is the tube that connects the nose to the ear. Whenever there is an infection, you have some fluid collection behind the eardrum, which usually comes out through the eustachian tube to the back of the nose. But when the adenoid tissue is blocking the exit of the eustachian tube, the fluid remains, and this may lead to repeated ear infections, and children with chronic adenoid hypertrophy may have small holes in the eardrum which may later on become big, and they may require a ear surgery later on. But most of the time what happens is the children adapt to it by making changes in the facial structure of the face, by elongating the face and mouth breathing. They do it, but still they may have some facial deformities because of the chronic adenoid hypertrophy.